people become infected with HIV, the virus that causes AIDS, as a result of drug use. Some 3 million intravenous drug users are HIV positive. I spoke to Kolawole Oroluwa, a rehabilitated intravenous drug user from Nigeria and a youth advocate. He says intravenous drug users typically do not worry about HIV infection.
Drug users don't really bother about injection. You know, any injection, any needles they see, they inject themselves. Because these are things you can't go to anywhere and say you want to buy it or something. So anyone they have, you know, at hand that time, that's one they use. So these one, you know, contribute to a lot of transmission of HIV/AIDS. That's number one. Number two, you know, in drug use, there is what we call overdose. When somebody is overdosed, you know, you can go extra mile of having sex without condom, without anything. And, you know, these are two things I think that are, you know, cause transmission of HIV among drug users.
Now, if I understand correctly, you are not infected.
I got hepatitis,
Okay.
which I later, you know, developed immunity against it. I've seen a lot of HIV/AIDS positive guys, you know, who got it from injecting themselves.
Tell us about what you do as an advocate.
What we do basically is we train them through peer education how to, you know, to talk about HIV/AIDS, so how they can prevent HIV/AIDS from injecting themselves. And also we also do what we call needle and syringe exchange, whereby we go to the street and we collect those needles and syringes they've used, and we give them another one so that they will not reuse it.
In case they are infected,
yeah.
What do they do? What do you provide?
We refer them to hospital where they can have access to drug.
One of the consequences of using drugs is the fact that the person doesn't really have his full capacity to make a decision what's right from what's wrong. So how are you able to talk to someone who's using drug that what he's doing is wrong, this is the way you should do it? How do you do that?
We have what we call harm reduction. We tell them what is overdose means. We tell them the harm this drug can do to them and their environment. But that doesn't mean we are not telling them to quit, because if we tell them to quit, it's not easy.
It's not stop using it.
Yeah, it's not stop using it. Because I believe that when you tell them the harms this can cause them, they can reduce the harm, and by doing that, they can quit it. You know, unfortunately in Nigeria, to quit the drug is not easy. If you want to quit the drug, you need a rehabilitation center to go, but there's no rehabilitation center to go. So it's just a personal decision. Like, you know, I told you I was a drug user. It's a personal decision.
And your final message before we finish this interview, what would be your message?
Yeah, the only message I want to pass now is just I want the U.S. government to support injecting drug users, because they have a PEPFAR project going on now, and the issue of syringe exchange is not there. So they are not funding that, and this is something that applies to all their projects all over the world.